The Health at Dermatology program comes as three main streams. The first one is the professional certificate, the next one is the advanced certificate, and the last one is the diploma. With each further course, we go into a little bit more detail and depth into some specific conditions, starting out a little bit more generalized. And this general dermatology course really covers some of the sort of basics and then more advanced things that we'll see in our everyday sort of dermatology practices. In the initial certificate, the professional certificate, we cover off things like benign sort of lesions that we see in everyday practice, which sometimes is more difficult to diagnose than skin cancers themselves, to tell the patients what these are. But we also cover other conditions such as vitiligo, some infections, and a brief introduction into hair disorders and nail disorders. As the course goes on, we tend to then go into a little bit more detail about those conditions and also management of those conditions as well. And one of the important things in the course is, again, to look at not only the skin but how other things can present. So the course goes into a lot of other systemic conditions that can present in the skin as well. We also do live webinars where I actually present overviews of the course, which allows the people that are attending the live webinars to ask questions live about the course or anything dermatology related, which I'm always happy to field and hopefully be able to answer those questions, which is quite useful for candidates in terms of listening to us talk and then being able to ask questions about that. There's also within the Health Cert course opportunities to have reviews of cases, so peer review cases where GPs will see patients and basically present what they've done with them, and then we can give feedback on that as well. Dermatology, I think, accounts for anywhere up to 15 to 20% of GP presentations. So it's a fair amount of the initial presentations, which means that if they're upskilled in dermatology, they'll not only feel confident and able to deal with that, but they'll also be able to, I guess, almost save the patient from having to be referred to a dermatologist for everything dermatology related, which is quite useful. The wait list for dermatology clinics can be a little bit long, and obviously we're here to help with anything. That's what we're here for. But upskilling in terms of dermatology skills is really important because they're the first line that they'll see things and recognize. Not only dealing with problems with patients, but actually recognizing what needs to be seen urgently or not as well. So for example, if a GP is upskilled and can easily recognize a squamous cell carcinoma or melanoma, even if they're not able to necessarily manage that themselves, just recognizing that and referring that to dermatology and making sure that's an urgent referral is really important, because as a dermatologist in clinic, if we get general referrals from GPs, we always want to see the patients, but if they can describe the problem or tell us exactly what's going on, it makes our life a lot easier to be able to triage things, and then the patient actually gets dealt with in a more timely manner as well. So recognition of problems and recognition of what needs to be seen quickly and what doesn't need to be seen in terms of things being missed with patients is really important.